Hi, my name's Steve, and I'm from Miller Pharmical. And for those of you who have been here a few years, I have too, right from the beginning, and before that, my father. Dr. Miller developed a chelation complexing of minerals back in the late 50s. The company was started with that idea in 1958, and one of the products was a chelated magnesium supplement that's been on sale ever since. And speaking about magnesium to this group almost seems childlike. Everybody knows it's important in keeping people healthy, but it's also grown more popular with mainstream medicine, and we also promote it to cardiologists, transplant programs, oncologists, and it actually has become quite popular. The most common one are cardiologists using it to treat the side effect, the hypomagnesia from diuretics, but many oncology patients suffer from it because the platinum-based therapies from carboplatin, oxaliplatin, cisplatin, all are nephrotoxic and reduce magnesium levels, and in some cases quite severely. Talking to those doctors is quite a bit different than talking to you, because most of them don't know that much about magnesium. They'll do a blood test, and if somebody complains about leg cramps, we'll increase the level of potassium, not knowing the two go together. Transplant medications, the immunosuppressants used in solid organ and bone marrow transplants also cause low magnesium levels, and those patients will go below 1 on a blood level, which is just dangerous, cardiac and otherwise. And as far as that goes, kidney transplant patients have become the science, the surgery, and the immunosuppression has gotten so good that the patients are now more likely to die of cardiac implications than they are from what they call non-functioning graft. So they'll die from heart attacks. And all the patients are low on magnesium because of the tacrolimus, the mainstay immunosuppressant. Another oncology medication that's common is arsenic trioxide, which arsenic's a poison, but in the right doses and the right treatments can help cure leukemia. But those patients require their electrolyte levels to be maintained in the normal range to even continue, let alone prosper. It's interesting to talk to a doctor or pharmacist or nurse, and they'll look at their magnesium 400 and say, well, this is 400 milligrams. I gave them 800 milligrams of magnesium, not knowing that that's the tablet weight, not the actual elemental dose. I would say that's the majority in the hospital setting, don't know the difference between. They'll increase from Magox 400 to Maggluconate 500s, which contain 27 milligrams of elemental magnesium. They'll also commonly, in the solid organ transplant programs, use a couple drugs, and some of them all indicate diarrhea as a side effect, and then give the patients 2,400 to 3,200 milligrams of magnesium oxide and wonder why the patient's getting diarrhea. Well, it's not that hard to figure out. But the doctors, those doctors, and sympathy to them, they have a lot of other things to think about. And a lot of their nurse practitioners, physician assistants, and nurses will handle these issues. And they're actually quite open to magnesium, fish oils, and things like that. Anything that the patients can not get side effects from, that they seem to be more concerned about that. Does anybody have any questions? Because I could talk for hours about it.